Hello, everyone. Welcome to the Skin Wellness Pro Show, the official podcast of the Nutritional Aesthetics Alliance. I'm Rachael Pontillo, president of the Nutritional Aesthetics Alliance, and with me today is our education specialist, Tara Swagger. Hi, Tara.
Hi, hello. Glad to be here.
So, today we have a conversation that I think is going to resonate with a lot of our listeners, whether you are a provider who is more on the holistic side of things, or you work in a med spa, or you're somewhere in between, or you're not a provider, but you're into skin, because we're going to talk about acne, which is something that affects people of all ages. Well,
hmm
maybe not all ages, but I guess we could say all ages because
Yeah,
there's
for
like
sure.
baby acne, right?
Yep, for sure,
We're
for
not going to
sure.
talk about baby acne today specifically, but acne is something that can follow someone through their lives. It's something that can also pop up at random times during life. I was someone who struggled with acne personally from about age 10 to about age 32. And there were some years in there where it would get better and I would have like a light of hope and be like, oh, is it gone? Is it gone? Have I grown out of this? And then no, it would come back. And then it was like, oh man, it was terrible. I experienced a lot of the issues that come along with acne, kind of the psychological issues, some of the anxieties, the self-consciousness, the bullying. That's all unfortunately something that I grew up with. And even getting facials when I was in my 20s and still experiencing pretty severe acne, I would have estheticians say to me things like, oh, you're so pretty, it doesn't have to be this way. And I'm like, that's not helpful, but gee, thanks. And then try to sell me like $400 worth of product, right?
Hmm
Don't do that, listeners. That's just one suggestion right off the bat. Don't do that. But I've tried a lot of things over the
hmm
course of my experience with acne, and I know what has worked for like a little while and then not worked. I know what has maybe seemed to cause a temporary improvement. And then I felt like, oh, my skin outgrew this, which is not actually what happened. What actually happened was that it wasn't the right solution. Um, and then I finally did address it holistically, both from the inside out and then the outside in a way that finally tamped it down enough that I didn't need to use acne medications or acne ingredients, harsh ingredients at all. I was able to switch to products that I made myself, and nothing else was necessary to manage breakouts. And anytime I would get breakouts after that, and even today at 46, I mean, my skin's a lot different now at 46 than it was at 32. But if I don't get enough sleep, if I, go to an event and I've had some alcohol and maybe some dessert, if I have high levels of stress, those are times where I might get a breakout, but I always know why. It's not ever like, where did this come from? Why is this happening to me? Because the initial kind of root cause of the acne itself is something that I was able to work out holistically. Um, so when I, had my practice, which was essentially a nutritional aesthetics practice where I was working with clients virtually, helping them with choices with food, lifestyle, mindset, and topical recommendations. A lot of my clients had acne because, you tend to attract what you put out there. And I was putting out a lot of acne vibes at the time since I was, putting so much focus onto recovering from that. And what I noticed is that I did not have a single client who did not see improvement using holistic measures. Now, is that to say that pharmaceuticals are never necessary? I'm not going to say that. And we had a webinar a while ago. It was a couple of years ago, but it's in our webinar library for our CNAP students and our members. They can watch it at any time with Dr. Michelle Jeffries, who's an integrative dermatologist. And I remember when I was approaching her to see if she wanted to be a guest to talk about acne, and she's like, I do, but I have to tell you, I do prescribe antibiotics, especially to my teenagers. And I'm like, we can talk about that, and we can talk about why. And the why was that sometimes, even if people are making changes with food, with lifestyle, doing all the things, sometimes they need a quick win. They need to see, especially if it's a teenager who is, surrounded by unkind peers, perhaps, sometimes that can help them. So, you know, my goal with wanting to talk about this topic today is that I'm not here to judge, but what I do want people to know is that there's a lot of ways up the mountain. And sometimes some paths are straighter, others have more twists and turns. We just want to help people get up the mountain, and that mountain, the top of the mountain, is clear skin, and clear skin that lasts, not just clear skin that lasts until you finish the product and then it comes back, right? So before we started filming this episode, Tara and I were just like, I asked Tara, you see clients in your practice, and Tara, why don't you just tell them exactly what you told me before, because I think this is such a valuable part of the acne conversation and why certain approaches are taken, even though there are all these other options.
Yeah. So, as we were kind of unfolding, and then we were like, we just need to start recording because there's just so much to talk about. And when you've been in the field as long as both of us have, you see a lot of different things. And I think, so for me in my practice, I don't see as much of the younger generation anymore as I did earlier in my practice. I'm generally working a lot more with more like adult acne, hormonal acne, that kind of thing. But it's very. I also don't take teenagers anymore, so maybe that's why.
That could be a big
And
part of it.
and the reason why I don't do that anymore is because for the most part, when I had clients coming in that were in the younger generation with parents, and I live on the East Coast, so I was kind of saying to Rachel before this that I was out in California at a holistic health center, and it is interesting how different demographics have different attachment to medical or holistic. And I feel like in some parts of the world or in our country alone, that you're going to see more people that are into the holistic side of things. And I find where I am, people are definitely more geared towards the medical. And so my my biggest bridge always with clients was that they wanted a quicker fix. And I I totally understand exactly what Rachel just said. There's a psychology here with acne that I think is very, very underrated, unfortunately. And it can be extremely debilitating when people are suffering from acne and they're having those experiences, like you said, in school or with their self-esteem. And so I've always taken the personal approach that I don't tell people whether they should or should not do the medical route. I don't tell people, that they shouldn't do some of those things. Now, while I personally, and I'll just share this as a caveat, I personally, um, if I was taking the track for myself or my own children, I would not personally go that route in the sense that that's just not for me. And so, but again, I don't share that to I don't tell a client not to do that because you can't as a practitioner determine the entire package of what that person's dealing with when they're struggling with acne. And the truth is when the inside out approach, which I think in my personal opinion is the most valuable approach, because you've got to pull the weed with the root intact. Okay, if you're just cutting it in the grass, it's going to keep growing. And I've actually seen that in my practice with the younger generation when I was working with younger kids, is that they go do Accutane, which is a very serious,
Mhm.
serious medication to go on
With long-term ramifications
with
that a
very
lot of people
long-term
don't
ramifications.
understand.
And a lot of those ramifications are mental health issues, which I think at the time when I was working with that population, 15 years ago, I didn't know that. I think we know that more now because we've seen some of those longer term effects. And even in the insert for that medication, it also indicates suicidal tendencies if you are taking Accutane. And I think that is a pretty serious thing to get on. And I'm not, again, not suggesting you should or should not do that. I think you have to kind of know all the parts of it and make decisions based on what works for you, without a doubt. but that was a very highly promoted option where I am. General practitioners putting young kids on Accutane, and a lot of times the acne that they were dealing with could have been managed, sometimes could have been managed very easily topically. And
Mhm.
sometimes it just was a matter of, you know, cleanliness or doing, you know, a good skincare practice. And teenagers are just not, they're not the most compliant
They are not the most
demographic. Yeah.
compliant demographic.
So and that's kind of what led to the reason why I don't work with teenagers anymore. I mean, I would if it was somebody, a client that was really was really interested in what I was going to provide, but it became very difficult because, you know, most of the time it was like, oh, she couldn't help me. Well, I couldn't help you because you didn't have the answer in a facial. You didn't have the
Mhm.
answer in one, you know, 1 week of doing, you know, integrative practices. It's a road, you know, it's a journey to heal. But the thing is about acne is by the time you're seeing it, you know, that means you've got something internal that's going on, and your skin is an organ expressing the inflammatory response that's happening inside. And so,
Or the dysbiosis that's
or the
happening inside.
dysbiosis, yeah. And this is the thing. So, you know, I think from a holistic perspective or an integrative approach as a practitioner is, you know, you got to dive deep into all of this information and kind of know what all the options are, and know and be able to really work with clients diligently, you know, because they need the support if they're going to take the integrative route. It's not like I'm just going to go to and get, you know, maybe some pill or Accutane or whatever. You will get results that way. They do come at a cost,
Yeah.
and they don't generally change the trajectory of whether you're going to have acne in the future. And so I think that people have to make their own choices. But one of the things that you kind of spoke about in your journey, which I think is important for people to hear, is that there is many mechanisms by which people are going to experience acne. So, you know, while your journey is going to be helpful and you're going to share information about that, and it could be helpful to somebody to hear something they didn't try or they didn't do, the human body is so miraculous and so different person to person, and environments are different person to person. You know, your haplotype, like what your nationality brings to your genetics plays a part. There's
Absolutely.
the puzzle is so intricate for each person. And I think the one thing about acne that I've experienced as a practitioner is that most of what you see are these one size fits all, like buy it. You know, I
Yes.
went through the proactive days. You obviously remember the proactive days.
Oh, I went through it too. I still have peroxide stained pillowcases from that
Yeah,
period.
yeah. And so, you know, while I think that that practice probably shifted the needle for some people, when it gets sold as the this is your acne answer, I think
Yeah.
that's very misleading. So personally as a practitioner in my practice, I'm working very diligently with clients to find the mechanism of action that's occurring in the body that is causing them to have the acne, which is not going to necessarily be the same as the next person or the next person or the next person.
Yeah.
And I think one of the things for me, which is, even though I'm not working with the teenage population, I see it in the adult population, is that we are in a very environmentally toxic world, and we are exposed to things that people don't realize is affecting their inside out health. And we talk about this all the time
Yeah.
anyway. But and I'm certain with the younger generation, it's worse than it was 15 years ago, 10, 15 years ago, because food products have gotten worse.
Mhm.
Exposure to different chemicals in their body products and makeup. I mean, those industries are just wrought with chemicals. And so the exposure that they're having more so from early ages, like infancy and on up, these are all affecting your body's ability to handle the dysbiosis, the inflammation, the things that are supposed to be functioning properly. So, you know, it's the mechanism of action that I think is where you have to really work diligently with a client to find out what's in their lifestyle, in their environment, in their culture, in the foods that they might be eating. And it's a very deep approach, I think, as a practitioner that you want to take. So I think if you're going to work with acne clients, there's a lot to learn. But it's hard to, I would say it's hard to find, because if you start like looking up acne and reasons why you get it, it's all very much old school information that
Yeah.
really doesn't dive deep into lifestyle. And so that is why being a nutritional practitioner, nutritional aesthetics practitioner, is so valuable, because you can start to unravel lifestyle and what your client needs on a very personal level, so that you can find those mechanisms of action. And I love that you mentioned stress,
Yeah. Yeah. Because that's
because
something that is and this is the way I teach it. When we have the stress and your skin pillar in the certified nutritional aesthetics practitioner training program, it is my favorite thing to teach, because I think it's the area that we can most help, because stress itself is not a medical diagnosis. You're not going to go to the doctor and the doctor's not going to say, I diagnose you with, stress. But most
they
doctors
should,
are
they should.
going to say, you need to reduce your stress. You need to stop stressing. There's a lot of doctors who will say that, but they won't actually give them tools on how to do that. And where I think we really shine here at the Nutritional Aesthetics Alliance with our programs is that we are not just teaching theory. We do teach theory, obviously. You have to teach the thing, but then we teach you how to help your clients actually implement that in their practice, because that's where the disconnect happens. So many people who are struggling with skin issues like acne that are affecting them every time they look in the mirror, affecting them every time they're making plans,
Mm-hmm.
every time they're having to go into, a crowded room or give a presentation or think about, oh, do I want to go out on that date? Like, these are everyday ways that skin conditions that are visible affect people.
Mm-hmm.
And they might be told, oh, yeah, you should cut this food, or you should get more sleep, or you need to exercise more, or you should maybe start, meditating or deep breathing, and then they're already overwhelmed. They're
Mm-hmm.
already
Yep.
stressed. They're
Mm-hmm.
already feeling not enough in some way. So then when they're being told, you have to do X, Y, Z, A, B, C, and then they're like, okay, but they're not actually given concrete ways to implement that in whatever their daily schedule is. And everyone's busy. I
Mm-hmm.
have never spoken to anyone who is not going to tell me they're too busy, they don't have enough time, they don't have enough money. That's everybody's excuse for everything all the time. And I don't accept it, because while we don't all have the same amount of money, we all do have the same amount of hours in the day, and a lot of that has to be spent sleeping. So, you know, what we do in our lifestyle. I've had clients that, sure, do I want them cooking healthy foods at home every day? Do I want them meal prepping and packing their lunch to take to work? Of course, that's what I want. But if I have someone who's a busy CEO who's on a plane
Mm-hmm.
half of the week, in hotels, in conference rooms, surrounded by convenience foods and donuts and
Mm-hmm.
garbage.
Mm-hmm.
Is that helpful information for me to give her?
No.
No. So when I was working with her, part of how I was working with her was to help her understand how to make the skin healthiest choices
Yes.
within the confines of being in airports, being on a plane, being in hotels, being in conference rooms, not getting regular sleep hours, having to deal with the physical strain of travel, because it
Mm-hmm.
does. Travel
Mm-hmm.
affects people. We're
Mm-hmm.
not meant to traverse thousands of miles in
Right,
just a
right.
couple hours at very high altitudes. That's just not what the human body was designed for.
Mm-hmm.
So I think that implementation piece is what's missing in the conventional world, both in the medical on the medical side of things, because dermatologists just do not have that kind of time.
No,
And
no.
even in conventional aesthetics, because, and I'm not, again, I'm not coming at this judgmentally, and I'm not going to name brands or anything like that, but I know that there are these kind of like acne solutions in a box
Mm-hmm.
that are
Mm-hmm.
being sold, not just in dermatology offices, but also in med spas,
Mm-hmm.
where it might have some dietary recommendations, but these are not actually people who have been trained to make those dietary
Mm-hmm.
recommendations.
Mm-hmm.
And, you know, I've seen some of these recommendations. We've actually had some students come through the program who, during our role play sessions right before they earn their certification, they give me some recommendations, and they're not quite congruent with what they've learned through our program. And I'm like, well, what is this from? And it's from this other, company that does these acne programs. And some of those were like very specific with dosing of vitamins and stuff like that, and that's just not something we can do. That's something that's a little bit, you know beyond the scope, and that's
Well,
not what we teach.
doesn't
But
that also lend itself to the fact that like there's no such thing as a one size
that's
fits
right.
all, right?
What if
Because like
that's
that's
not
what we're back to.
appropriate for that person, because they don't know what other nutrients those people are getting. They don't know how their body is absorbing those nutrients. That you can't just say, "Here, do this and you'll be fine." And, even at the dermatologist, my daughter, my older daughter, um who has acne, but she has more like the folliculitis type of acne, because she's very fuzzy. She's got a lot of like a lot of
Superfluous
the
hair.
baby hair she always has. Um she went to the dermatologist for something completely unrelated to acne. She had like a cyst that she had to get looked at. And while she was there, the dermatologist is like, "Okay, is there anything else I can help you with?" And she's like, "Well, I do have acne." And the dermatologist is like, "Oh, here you go." Literally gave her a box of samples of, Retin-A, and I think there was a topical antibiotic in there, and it was like 3 or 4 medications in a box that he just handed off to her.
Yeah.
This is a teenager. Like, yes, she was there with a parent, but he did not consult with her. He didn't ask her a single
Mm-hmm.
question.
Right.
He didn't even ask if she was on other medications
Mm-hmm.
at the time
It's
that could have conflicted with. There was no personalization of that. And those were drugs. Those were
mm-hmm.
strong drugs
Mm-hmm.
that have long-term implications. So when she came home with that, I'm like, "What?" I was appalled. I was absolutely appalled. So whether it's, a solution in a box from a doctor or a spa, just understand that there is no solution in a box.
It's true.
And
It's so
while
true.
certain things might be beneficial for some people, because we know that everybody works for someone, but
Right.
is that going to work for you? We
Yeah.
don't know unless we
No.
have all of the information,
Yes.
history, information about the lifestyle. This is why we train our practitioners to do very thorough consultations,
Mm-hmm.
not just when they first meet their client, but
Mm-hmm.
every time,
mm-hmm. Yeah.
because things change. So
Yeah.
that personalization is just so important, and I just love I would love it if the solution came in a box,
Oh yeah.
because
That'd be
that would have
easier.
been,
I could
you know,
sell that.
20 years of my life that would have been a
Yeah,
heck of a lot
totally.
easier.
Yeah. Yeah, totally. It's interesting too because, like I said, I don't discourage any clients or people from seeing the dermatologist and
Mm-mm.
choosing the route if that's what they see fit. The unfortunate part is usually I say usually because this is what I find to be true is that they end up doing that route but then eventually coming back because
Mhm.
they struggled. And I think that when you work in an integrative practice like we do, a lot of the things that I talk to my clients about are solutions that don't cost them money,
Right.
and I don't there are very few products that I recommend topically for my clients. because I don't want them spending money on a topical product. I want them to help fix the problem. And so while the topicals are always going to be a great way to move the needle and kind of get you through and help that skin look its best on the outside, you still have the issue coming up every day underneath the
Yeah.
skin. So, the things that you can help your client with are going to be diet. They're going to be, a lot of times my biggest one is earthing. If I can get my clients to earth,
Mhm.
because the science on lowering inflammation in the body is incredible. It's free. you
I
know,
know. Go
garnering
outside, stand on ground.
garnering electrons from the earth is such a huge impact on a person's ability to manage inflammation. And I use that with all of my clients that have skin health issues, eczema, psoriasis, anything that is presenting itself with inflammation, that I want to see them work on those things first,
Mhm.
before they come back. And then I go, if you're really into it, we'll get you into some products, right? I feel
Right.
like topicals can be the optimizer, just like supplements can be the optimizer. And just like your CEO flying all over the world, you have to get yourself as a person someone who also practices these things in your own life, so you have something to deliver as a practitioner to the clients with when they're having those issues, and so that you can help them find solutions when they travel, because you're looking for the solutions when you
Yeah.
travel, right? Like, I feel like we do a lot of weird stuff when we travel because we don't partake in, we do a lot of packing of our own food. And I open a
Bring my own
suitcase.
pillowcases.
Yeah, I open my suitcase and like I've got my own snacks that I'm traveling with. And
Yeah.
sometimes it's my own, it can often be my own salt. I always have a little salt in my purse, and because I don't want to use table salt, like things like
Right.
that. And so they are kind of strange and they can be a little bit different. And while I've been on my journey, you've been on your journey for a long time, we've kind of
Mhm.
probably garnered ourselves a long list of things that we do.
Mhm.
If you're working with a first time client that doesn't do a lot of these holistic practices, you do have to really talk to them and find out each little thing that's doable for them to do, so they can
Yes.
have structure a lifestyle that brings them, moves the needle and implants itself so it stays, right? Like once that person goes with that one thing that they can do 15 minutes of earthing every day, if they come back, they're like, yeah, I've been doing that like 4 or 5 times a week. I feel great. My
Mhm.
acne's shifted, my eczema shifted, my psoriasis. They know now that there's some one thing that has already shifted the needle. So what's the next thing? And they've
Exactly.
implanted that. And so it's very important. And, in terms of like people going to the dermatologist, they're never going to get an integrative approach from just your average, medical professional. They're not, because that's not what they're trained to do. So I
And it's
think
not
it's
what they have time to do, especially if they're working
exactly.
within the insurance model where
Yeah,
they
yeah, yeah.
have patients in the waiting room
Mm-hmm.
and they're double booked. It's just a different, like, there's the quote unquote standard of care
Right,
that this
right.
is how we do this in dermatology when we are working with insurance. This is
Mm-hmm.
how we deliver dermatology medicine. But and this is why, I am starting to see more dermatologists who want to offer their patients more.
Yes.
They're getting training in the
Mm-hmm.
when we've had dermatologists in this program. We
Mm-hmm.
also have Dr. Nana Bawachi, who's on our advisory board. She does a ton of integrated practices, and her Instagram, she is always talking about lifestyle and fitness and
Mm-hmm.
food and all of these different things. And I believe in her practice, she stopped taking insurance because she wanted to be able to
It was
have,
an effective model.
no, exactly. She wanted to
Yeah.
offer her patients more.
Well, I
And
think
I
that's
realize that that's not going to be affordable for everyone,
mm-hmm.
but sometimes, and it's funny because when Jen Fugo and I collaborate on clients, I teach for her skin rash rebuild course whenever she offers it. And sometimes some of her students will want to consult with me. And yeah, like my hourly rate is what it is, but usually we only need 1 or 2 sessions,
Yeah, to get
and
it.
and then they're good to go
Mm-hmm.
because they're also, working with her as well. But
Mm-hmm.
when you meet with a dermatologist or a provider who is working on all of these various aspects with you, you don't necessarily need to then be spending
Mm-hmm.
money on copays and medications as frequently,
Mhm.
and the problem actually will resolve, which means you won't
Right.
have to spend money on it
Right.
after that.
Right.
So it's kind of a little bit of a paradigm shift and a
Mhm.
little bit of a mindset shift when we talk about money. And again, I'm not here to tell anybody what they can or cannot afford, because I know that
Right.
that's a different, heavier conversation where there's so many different nuances.
Yeah.
But we are just starting to see a lot of dermatologists frustrated with the fact that in the current allopathic managed care model, they cannot deliver the depth of care that they want to.
Mhm.
And I was having a conversation with a dermatologist recently who was frustrated because she didn't think that her patients would even want to spend money on things like supplements or things that are not covered by insurance. And I said, okay, but do you realize how many of these patients who these medications are not helping are still having to then seek that
Mhm.
care elsewhere where they do have to pay? So
Mhm.
essentially, they're paying twice. They're paying you, they're paying for the
Mhm.
medication. They're not getting results, so they're paying with how that's affecting their life, and then they
Right.
have to pay someone else to help them in a different way. So really, I'm all for this integrative movement within dermatology, and I hope it spreads. And I know that there's a couple of certification programs out there that are, specific to doctors. Um, and that's fantastic, but it's moving really slowly because it takes time
Mhm.
within the medical community. They want to
Oh,
see
yes.
research, and there's just not research on, botanicals. There's some, but there's not as much published research on, let's use
Well,
hemp seed oil for acne, for example. I just made that up, but like, you're not going to find a ton of clinical trials on that because the majority of the clinical trials have been studied for pharmaceutical reasons in the first place,
and nobody's
and
going
they
to make
cost
money
money.
there. Right. And
Yeah,
nobody's going to make money off you. No, nobody, including myself, which is one of the things I say to my clients when I start to talk about like circadian rhythm balance and earthing and things that are natural is I can't monetize that.
right.
Nobody can. So if you have people that are healing themselves and moving the needle for their skin disorders and acne in ways that don't cost money, no one's going to fund more information on that, which by the
Right.
way, earthing does have a ton of research
It
on it.
does,
So,
and
you
it's been
can look
around
that up.
in all over the world. This is not a new thing. It's just
No,
maybe new
but
here,
I think
trendy now.
I think that's part of the problem too. But I do think the other thing is, as a patient or a client, when you see your dermatologist, and this is sort of in the defense of dermatology who isn't spending time in lifestyle, who hasn't
Sure.
decided that they want to move into integrative stuff, is that I think a lot of patients and clients have an idea that the dermatologist is going, has, does all of those things, which they don't. And so
No.
it's sort of like, if you need your shoe cobbled, you don't go to the tailor, right? The tailor works on clothes, but like shoes are different, right? And so it's sort of like us. And so where medical's taking forever, and they always will, because even in my coursework with other physicians, even the physicians say it's a 50 to 60-year cycle in order to get anything to permeate the medical establishment. And I've heard many of them say that. So
Yeah.
that's not new. I think that's a pretty common thread of knowledge, is that if there's something that works that's different from what they're using, it's going to take that long to see it permeate into the mainstream model. But that's a lot of years for people to suffer or not be able to get
It could be a
information.
generation
Yes. And
of
so
people to suffer.
here comes the certified nutritional aesthetics
Yeah.
practitioners,
And
right?
look, to
Like,
clarify, we're not here to diagnose, we're not here to
right.
cure or treat disease, but we can help
We
so
offer
that
the piece that they don't.
exactly.
We
We
offer
can,
the lifestyle piece they don't.
and honestly, even if your clients are going to be on medication, what
Mm-hmm.
you can give them in terms of helping their bodies, helping their health become as resilient as
Mm-hmm.
possible, that is hugely valuable because that's going to help minimize the negative effects that those medications might cause. in the
Mm-hmm.
long term, because antibiotics, steroids, even, high dose vitamin A type of things,
Mm-hmm.
they shift the microbes in the body, in the gut, and on the skin. They shift the hormones, they shift
Mm-hmm.
they shift your chemistry, your biochemistry, they shift neurotransmitters, all these different things. And we know that healthy lifestyle, healthy mindset, healthy food, all of these things together can also modify those things, but in a
Mm-hmm.
good way.
Mm-hmm.
So, helping our clients become as resilient as possible, even if they have to undergo something like that, or they choose to undergo something like that, the negative effects will hopefully then be minimized. And
Mm-hmm.
I've had some clients who were on a steroid or on a topical antibiotic or something, who then just realized, hey, I don't need this anymore because my skin's getting better. And listen, not everybody gets results from medications. I do want to
Mm-hmm.
throw that out there,
That's
because
true.
I was
That's
someone
true.
who was put on retinoids. I was put on antibiotics, both internally and topically, and I was put on steroids. And guess what? They didn't clear my skin. They made my
They're not
skin,
without side effects.
yeah, they made my skin red and
Mm-hmm.
peeling and chapped and
Oh,
swollen,
yeah. Mm-hmm.
but they did not actually clear my skin.
Mm-hmm.
And I was like, well, and the doctor was like, well, we should just try a different medication. And
Mm-hmm.
after a while, I'm like, why would I do that? I've tried three, none of them have worked. Why would I do
Mm-hmm.
that?
Mm-hmm.
And then that's when they were like, well, maybe you need to start getting facials. Okay, so I do that. And what do they want to do? Chemical peels,
Yes.
microdermabrasion. Let's
Yes.
let's sandblast it off. Let's
Yeah.
grind it off. Let's burn it off, which might have helped for, a couple of weeks, and then comes
Yeah,
back.
so that's a piece I think we should shed a little light on too, is exactly what you just said. So in skincare, in the skincare industry, you get a lot of especially now where there's dermatology and med spas are now doing a lot of lasering and things
Yeah.
like that. Now, again, this is still a temporary solution if it works for you, because you're still producing the acne. And so this is the part that's also very a struggle for me with clients, is that, again, if you want to go do the laser, but I also think they're not getting all the information from the people working in those fields, because what you're also doing is you're damaging the layers of skin. And when you keep removing all that epidermal layer, which is what we do and what we used to, well, at least what we used to do with
Yeah.
chemical peels for years, because that was pretty much what we did
Well, a lot of
in
a
our
lot of
industry.
practitioners still do
and
it.
and a lot still do. And yes, you are going to have what looks like beautiful skin in that 4 to 6 week period after having that treatment. There's no doubt about it that the pictures aren't going to lie, but at what cost? And
Yeah.
so I think it's important to also note that the more you thin your epidermis, okay, then the less active your DEJ, which is your dermal epidermal junction, is going to be. Now, the dermal epidermal junction is what you want. You want that to be a vibrant, really healthy section of your skin, because that's where all the nutrients are. It's where the blood is flowing. It's where all the action is happening in terms of having good, healthy external skin.
That's where the
So
stem cells live
it's where
that
the stem cells live.
differentiate into ultimately the corneocytes, but the keratinocytes, and then other immune cells, other cells that are in those epidermal layers, they live at that DEJ as well. And
So the more you thin the epidermal layer, the less your DEJ is going to produce. It's getting the message that you have less skin to manage. And this has a long-term effect. And I think I'm seeing it in my practice with people who did a lot of these thinning skin treatment creams from the dermatologist with retinoids
mhm,
and retinols. And their skin is very, very thin, and they're getting more wrinkles because I think their DEJ is so compromised as well. And this is the part you can't see,
right.
but you want to feed that section of your skin. It's sort of like feeding the soil in your garden. If you don't grow a lot It's not having that rejuvenating effect of like things dying and refeeding the soil. And so you really you really have to consider what the long-term effects are. If you're using that as a one-time thing or one series to kind of move the needle for you to feel and look better, I get that.
Mhm.
But a lot of people are selling these very high intense laser solutions as a continuing, every time your acne comes up, come in and get lasered, come in and get lasered, but you're still producing the acne. So
Right.
why not get to the bottom of that? And
Right, and
then
talk about spending money.
I was just
That's
gonna
not
say
cheap.
that's the other part, right? Because like it's not cheap. And I don't know. It's I guess it's interesting to see how the world has just moved so far away from nature and in
Yeah.
every aspect of our lives. And I think that when you work in this field integratively and holistically, I think it's such a beautiful space because we can reintroduce people back to the things that are really functional because they align with our actual biology and our genes and how we're supposed to function in nature. And there's no mistakes there. The mistakes that have happened have come from this modern life where we're covered in pesticides and we're in all kinds of artificial light
Yeah.
and we don't see nature and people are stuck inside. And so it's all of the modern stuff that is really cycled into our human nature that is starting to make all these problems. And then we're giving them modern solutions when really we just need to get back to nature, you know?
I think that's such a valid point, and I wanna add one more thing to just what you were saying about how, when we constantly we're thinning the epidermis, we're removing these epidermal layers with these, peels or microdermabrasion or lasers or whatever. What that's doing to the dermis is not being talked about enough,
Mhm.
and obviously that's not necessarily something that a client is going to want to hear about. They're not going to want to hear about, well, this might harm your dermis. But, the dermis, that's where the collagen is produced. That's where the
Mhm.
elastin is produced. That's where the blood flow that brings the nutrients from the food that you
Mhm.
eat, digest, and absorb. That's what brings it then to the DEJ. And that's what delivers the nutrients into those stem cells so that they then know what to do and they can do
Mhm.
that properly. But if you're constantly inflaming that
Mhm.
epidermis and sending signals that basically fire, 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 I'm on fire. This is inflammation. This is a wound. Heal,
Mhm.
heal. That
Mhm.
is what the dermis is going to focus on more is producing more blood flow, sending more nutrients constantly to heal that damage, to put out that fire. And that ultimately can come at a cost where,
Mhm.
the collagen and the elastin maybe are not getting what they need. The fibroblasts, the cells that produce those might not be getting what they're needing. And ultimately, the dermis can then become compromised and the dermis
Mhm.
can thin. And the
Mhm.
thinning dermis,
No, no mas. We don't want
yeah,
that.
that
We
is
want a
not,
healthy dermis.
yeah, that's not reversible. That's
We want our
that's going to cause
production.
premature aging.
I always say this about the skin. I always refer to it back to as like a manufacturing company, right? Like you need the production to go well.
Yeah.
You need good production, and that's what's happening there in the dermis. And if there's no buyers on the outside, meaning like I call that like in the epidermal layer, right? If there's no buyers, then we're not selling the product. So then we're going to stop the production's going to slow down because we don't have product to feed. We need a healthy epidermis so that the dermis is something to feed. So we
Mhm.
want that production to keep going. And I think that's the part about all those lasering type of scenarios that is really unfortunate because yes, it will produce something that looks pretty good, but ultimately the long-term results are not going to be favorable for you to have healthy collagen and all the things that you want your skin to do. And
Yeah.
that's not being told to patients and clients, you know. And
Yeah.
so I think those are the things from a holistic perspective we really want people to know. You still want to do it, then by all means, but
Sure. If you still want to offer
understand.
that in your practice because you're seeing results, do that. Like, I'm
Right,
not here to tell
totally.
you what to do. I'm not here to
Exactly.
police you or judge you. But if you're offering a treatment that is inflammatory, period, there's no way around it. It is creating inflammation, even if it's superficially. then I do highly recommend that you educate your clients on how their bodies can become more resilient so that they can actually handle that,
Yeah,
because
totally.
most people are walking around with too much inflammation anyway,
Yes,
just from living a
exactly.
toxic modern
Exactly.
life. Not everybody can handle added inflicted inflammation. The
Mhm.
theory I understand, but the theory does not necessarily translate to the fact that we live inflamed lives,
It's
if you
true, it's
will.
true.
Many
Yeah.
of us are struggling with some sort of inflammatory issue already, whether it is a chronic disease or an autoimmune disease or high stress. We have so much inflammation in our
Mhm.
lives. Adding more is not a long term solution. So
Mhm.
we have to make the body, make the lifestyle overall more resilient. And then if the person is able to, if the person wants to have a treatment once a
Mhm.
month or something.
Well, and that's the integrative approach, right? The
Exactly.
integrative approach and the holistic approach is that your client can have all the information and you can find a pathway to get them where they want to be that isn't a one-sided scenario, but that they
Yes,
actually make strong lifestyle changes to support things that they may be adjuncting with more modern solutions. And so
absolutely.
that's being certified nutritional aesthetics practitioner and
Yes.
understanding that so that you can help your clients really achieve what they're really looking for.
Absolutely. So I think that's a perfect place to close for today. Tara, thank you for being here and sharing
Yes,
your
glad to be
perspective as
here.
always. I always enjoy our conversations. And I want to just remind our listeners and viewers, if you liked this conversation, if you found this valuable, and you want to learn more from us and earn the Certified Nutritional Aesthetics Practitioner certification, that information is at our website, www.skinwellnesspro.com. You can also check out our blog there. All of our podcast episodes with the video, the audio, and some show notes are also there on the blog. You can get the audio of this podcast on Apple Podcasts, iHeartRadio, wherever you get your podcasts. And then on our YouTube channel, we have all the videos of the episodes as well. So while you're there, we invite you to give us a like, subscribe, leave us a review or a comment, share your thoughts. And if you know someone who's struggling with skin issues, or you know another practitioner who is looking to learn more about this integrative approach and how that works in their practice, please encourage them to listen to the Skin Wellness Pro Show, because we've got a lot more great conversations planned for you. We've got more educational opportunities um, on the website planned for you as well. So stay in touch with us, and we'll see you next time. Bye.
Awesome. Bye.